Hello, friends. I'm Dr. Melani Rubio, and today I want to talk to you about a very important topic for all the gentlemen listening to us, especially for those of you who are over 60 years old. We're going to discuss the prostate, that little gland that can cause so many problems as we age. And we're also going to talk about something many wonder about but few dare to ask their doctor, the relationship between sexual activity and prostate health. I know many of you have heard about the prostate, but you may not know exactly what it is or what it does. The prostate is a walnut-sized gland located just below the bladder surrounding the tube through which urine exits. Its main function is to produce a special fluid that forms part of the semen, approximately 30% of the total volume. This prostatic fluid contains important substances like zinc, enzymes, and something you've surely heard mentioned in your medical checkups, PSA, or prostate-specific antigen, which is that blood test they do to detect prostate problems. Now, when we talk about ejaculation, many older men are surprised to learn that most of the semen doesn't come from the testicles as many think. The testicles only contribute the sperm, which represents barely 1% of the total volume. The rest comes from the prostate, and some glands called seminal vesicles. That's why when there are prostate problems, there can also be changes in ejaculation, something that's completely normal but can be concerning if we don't know about it beforehand. I want to share something very interesting that scientists have discovered in recent years that has caused a lot of discussion among doctors. It turns out that several large studies, including a very important one that followed more than 30,000 men for almost 20 years, found something surprising. Researchers observed that those men who ejaculated more frequently had a lower risk of developing prostate cancer compared to those who ejaculated fewer times per month. Specifically, they found that men who ejaculated 21 times a month or more had a significantly lower risk than those who only did so between 4 and 7 times a month. But here comes the most important part. Friends, and I want you to pay close attention. Don't worry thinking you have to meet a specific number of ejaculations per month. Science still hasn't established an official recommendation on how many times a man should ejaculate to prevent cancer. Each person is different, and what's normal for one may not be for another. The frequency depends on many factors like age, overall health status, whether you have a partner or not, and simply how you feel in your day-to-day life. Scientists have several very interesting theories about why frequent ejaculation might protect against prostate cancer. One idea is that by ejaculating regularly, you eliminate substances that could be harmful and that would otherwise accumulate in the prostate. It's like when we regularly clean the house, pipes so they don't get clogged, right? If we let too much debris accumulate, eventually we're going to have problems. Another theory is that regular sexual activity helps maintain a healthy hormonal balance and improves blood circulation in that entire area, which is very beneficial for overall health. It's also been seen that regular ejaculation can help with other prostate problems that are very common in older men. For example, many gentlemen your age suffer from chronic prostatitis, which is an inflammation of the prostate that causes discomfort when urinating, pain in the area between the testicles and anus, and sometimes even lower back pain. A very interesting study found that men with this problem improved their symptoms when they increased their ejaculation frequency, whether through sexual relations or through masturbation. And here I want to be very clear. Masturbation also counts, and there's absolutely nothing wrong with it. It's a normal and healthy activity at any age, so don't be ashamed if it's something you practice. Something else my older patients ask me a lot about is sleep and whether sexual activity has any relationship with sleeping better. Well, it turns out there is a connection. A recent study from 2023 found that people who had sexual relations a few hours before going to bed slept better and more deeply. So besides the pleasure it can provide, sexual activity can bring other important benefits for overall health, including better nighttime rest. Now let's talk about something very important for many of you, prostate surgeries and how they affect sexual life. When the prostate grows a lot and causes urination problems, what we doctors call benign prostatic hyperplasia, sometimes it's necessary to operate. In these surgeries, we remove the part of the prostate that's obstructing the passage of urine, but we leave the outer capsule. After this operation, many men experience something called retrograde ejaculation. What does this mean? It means that the semen, instead of exiting through the penis as it normally does, goes into the bladder. This isn't dangerous at all, but it can be disconcerting if you don't expect it. The man still feels the orgasm the same as before, but doesn't see semen come out. It's important that you know this before surgery so you don't get scared afterward. It's different when we talk about prostate cancer and the surgeries done to treat it. If there's a malignant tumor and it's necessary to operate, the entire prostate is removed completely in a surgery we call radical prostatectomy. After this operation, the man no longer produces semen because he no longer has a prostate. Additionally, there can be other consequences like problems controlling urine or difficulties with erections. That's why it's so important to detect cancer early, when there are still more treatment options that don't require such aggressive surgery. I want to tell you something very important about prostate cancer, prevention that everyone should know. Although frequent ejaculation might have some protective effect according to these studies, it's not a guarantee and shouldn't be seen as the only preventive measure. The most important thing, and this is an official medical recommendation, is to get regular checkups. All men over 50, or from age 45 if you have close relatives with prostate cancer, should get the PSA blood test and digital rectal exam once a year. I know the rectal exam isn't pleasant, and many avoid it out of embarrassment or discomfort. But it's a quick exam that lasts less than a minute and can save lives. It's also fundamental to maintain a healthy lifestyle to reduce the risk of prostate problems. Smoking is very harmful, not just for the lungs but also for the prostate. Obesity is another important risk factor. Eating a lot of red meat and few vegetables also increases risk, and not exercising is another problem. I recommend walking at least 30 minutes a day. It doesn't have to be intense exercise, just a calm walk through the park or around your neighborhood. Eat fruits and vegetables every day, especially tomatoes, which contain lycopene, a very good substance for the prostate. Beans, avocado, all these healthy foods are very beneficial. Many gentlemen tell me they no longer feel the same sexual desire as when they were young and wonder if that's normal or if something is wrong with them. I want to tell you that yes, it's completely normal for sexual desire to decrease with age. Testosterone levels naturally drop after 50, and many medications we take for high blood pressure, diabetes, or heart problems can affect sexual function. The important thing is not to pressure yourself or feel bad about it. If you have a partner, talk openly about the topic. Communication is fundamental. Intimacy doesn't always have to include penetration, hugs, caresses, kisses, holding hands. All of that is also important to maintain physical and emotional connection with your partner. For those who live alone, who are widowed, or for whatever reason don't have a partner, I want to tell you that masturbation remains a perfectly healthy option. There's no age limit for sexual pleasure and, as I already mentioned, it can be beneficial for your prostate and overall health. If you have difficulties with erections, don't be ashamed to talk to your doctor. There are treatments available that can help, from pills to other methods. The important thing is not to suffer in silence thinking there's nothing that can be done. I also want you to be alert to certain symptoms that may indicate prostate problems. If you notice you get up many times at night to urinate, if your urine stream is weak, if you feel you don't completely empty your bladder, if you have to strain hard to urinate, or if you feel a sudden urge to urinate and can't hold it, you should consult with your doctor. These can be symptoms of prostate problems that need medical attention. Don't ignore them, thinking it's just part of aging. It's important that you know that 80% of 80-year-old men have some degree of prostate growth, and many will develop prostate cancer if they live long enough. But don't be scared by these statistics. Most prostate cancers grow very slowly, so slowly that many men die with prostate cancer, but not from prostate cancer. That is, they die from other causes before the cancer causes them serious problems. That's why regular medical follow-up is so important to determine which cases need aggressive treatment and which only need careful observation. Remember, friends, Sexual health is an important part of overall health and quality of life. You shouldn't be ashamed to talk about these topics with your doctor. If you have doubts about your prostate, your sexual function, or any changes you notice in your body, consult with a health professional and be very careful with what you read on the internet or what friends tell you. There's a lot of incorrect information circulating out there. There are no magic diets or miracle supplements that cure or prevent prostate cancer, although many products are sold with those promises. To finish, I want to leave you with these practical tips you can follow starting today. Maintain the sexual activity that's comfortable and pleasurable for you, without pressuring yourself about specific numbers or frequencies. Get prostate checkups regularly, even if you feel fine. Maintain a healthy lifestyle with regular exercise and good nutrition. Don't smoke if you still do. Control your weight by staying active. And talk openly with your doctor about any concerns you have without shame or fear. The prostate is a small gland, but very important, and taking care of it is part of taking care of your overall health. Remember that aging doesn't mean giving up pleasure or intimacy. Each stage of life has its own joys and challenges, and with correct information and adequate medical care, you can enjoy a good quality of life for many more years. Don't let fear or shame prevent you from seeking help when you need it. I hope this information has been useful to you and helps you better understand your body and your health. Take care of yourselves, get your annual checkups without fail, and remember that prevention is always better than treatment. If you have more questions or concerns, don't hesitate to consult with your trusted doctor and share this information with your friends and family, because we all need to be informed about our health. Until next time, friends, and may you have very good health.